Hi, my name is Dorothee Bach. I'm French and Appiate Fellow Cohort 2020 based in Finland. In July 2021, I decided to apply for a 6 months international assignment proposed by WHO Europe to go in Kosovo and support the National Public Health Institute in implementing a study to measure COVID-19 vaccine effectiveness against severe acute respiratory infection hospitalizations. I wanted to help by bringing my knowledge and implementing studies elsewhere in the world, but also learn more about vaccine effectiveness studies and understand how public health works in another country. I began the assignments remotely first by participating to weekly online meetings on the protocol and questionnaires to be used for the study. And this is how I met the teams for the first time. And but this is something that is quite usual in pandemic time. Now we know it. Then I went to Pristina, the capital city, and of September to meet the WHO and National Public Health Institute teams face to face and visit the sites where the study would be implemented in Pristina and Prizren, another city, and understand also the severe acute respiratory infection surveillance system that would be used to run the study. So on site, my work consisted mainly by preparing all the documents necessary for the study, meaning the standard operating procedures, the forms, the workflows for the laboratory team, the interviewers for the different sites. I also had to try to think at all other possible situations that could affect the study, including technical problems in logistics. I also created the codebook, the variable dictionary for the REDCap database we would use for the study. And with the data managers on site, we created the questionnaires on the REDCap software. I was also able to participate to the first trainings of the interviewers on the use of the study material. So, of course, as any other missions or any work position, I faced some challenges. The main ones were to be ready to work alone, have to redo things if necessary, and sometimes also the language barrier was a bit difficult, especially when meeting the people who would be engaged as interviewers. So it meant that I had to be flexible to adjust the others' schedule and professional obligations. I was there to support and not to request from them, actually. So I really enjoyed this mission. This was the first time I was going to this part of Europe, and there I discovered a new culture, a new way of life, and my colleagues were always happy to talk about Kosovo with me, about the past, the present, and the future of the region. So it was very interesting. I also met new and amazing people at the local WHO team, the Public Health Institute, and they were always eager to help when needed, answer the questions I had, and move forward to implement the study, whereas they were completely overwhelmed with the COVID-19 surveillance in the region. What was easy also on that side is that the WHO office and the Public Health Institute were nearby. There were only 10 meters to go from one to another. And the teams were really used to work together. So that was very convenient for the study. And so doing this kind of assignment is always the opportunity to network and build new collaborations, new connections for possible future studies. Especially during this mission, as WHO was supporting the implementation of the same study in multiple centers and multiple other countries in the Balkans, we were meeting regularly online with the other country teams and deployed staff there to help each other and capitalize the experience for the study. So I was really lucky also to see the first trainings there on site before leaving. And what is still very nice is that I'm welcomed to continue participating to the weekly meetings, and then I can see the progress of the study. So far, almost 50 patients were included in the study. So I really have no doubts that the study will go well, as I know that very competent people are following it up and taking care of it on site. And I really hope that the Public Health Institute will gain even more knowledge in COVID-19 vaccination effectiveness in Kosovo and in strengthening the SARI and COVID-19 surveillance system there.